Hello and welcome back to Focus Atlanta. Thanks so much for continuing to watch. In this segment, we're going to talk a little about mental health awareness. I'm here with Sarah Phillips. The Carter Center is known for standing behind issues and advocating for each and every one of us on different levels. Tell me a little bit about their mental health awareness advocacy right now.
Absolutely. So the Carter Center's mental health program works to promote awareness about mental health issues, inform public policy, achieve equity for mental health care compared to other health care, and reduce stigma and discrimination against those with mental illnesses. So in service of this mission, the Carter Center has launched its second multimedia public awareness campaign here in Atlanta with generous support from the Arthur M. Blank Family Foundation. This campaign aims to raise awareness about Georgia's 2022 Mental Health Parity Act, which guarantees insurance coverage for mental health care at the same level as physical health care. The campaign is focused on Metro Atlanta communities, especially women who are statistically less likely to seek mental health treatment due to concerns about affordability and stigma for having a mental illness.
Now, I didn't know that women in particular were impacted in this way. I guess when I think about mental health awareness, I think of all of us, right? I think we all struggle, we all have issues, but to know that there's a stigma against women in particular is kind of disturbing because in so many households, the woman is the backbone of the family. They are kind of holding everything up. So to be in a place where we feel like there's nobody there to hold us up is pretty disturbing. How does this campaign kind of shed light on that?
Absolutely. Well, yeah, to your point, more than 1 in 5 U.S. adults live with a mental illness, but research has shown that particularly Black women often forgo treatment due to previous negative experiences with the healthcare system and stigma and cost concerns. So we partnered up with a number of community leaders around Atlanta, as well as the Georgia Parity Collaborative, which is a coalition of more than 70 organizations and individuals representing different industries, different advocacy organizations, different communities, all to ensure that the campaign reflects the diverse voices and lived experiences. So currently, we have ads running in local spaces around Metro Atlanta to reach people where they are. They can be found on the radio, on billboards, streaming services, pharmacies, newspapers, bus shelters, all with the message, your body and mind are equally important and now equally covered, which speaks to that, that law that Georgia passed in 2022.
That is excellent. You know, it's got to be really gratifying to be able to look back and see that we are making progress. You know, so often we see these issues and we wonder, how can we do better? Is there anything that we can do individually? You know, things seem bigger than we are. But when the Carter Center steps behind this type of initiative, when we have forces in the community that are pushing it forward, it makes it a little easier for us to digest, for us to pass along, to share with the next person. Is there a place on the internet? Is there some place that we can kind of tap in and make sure that we are doing our part?
Absolutely. So we encourage everyone to visit our campaign website, georgiamentalhealth.com. This website it walks you through what a parity violation might look like, whether that be receiving a denial from your health insurer for your mental health treatment or support, or perhaps you're paying a separate deductible for your mental health care versus your physical health care. It gives a lot of examples of what a parity violation might look like and what to do if you suspect that you have experienced a parity violation, whether you have private insurance through your employer or public insurance through Medicaid or the state health benefit plan. So we have seen, despite parity being a daunting topic and still very much in its infancy in the implementation of the law here in Georgia, that when people have the resources and information that they need to appeal a decision or a denial, they have had success in getting coverage for the care that they need, which is really hopeful.
It is, it is. And to your point, so often things seem hopeless, but with this kind of initiative, people know that there is something that they can do, right? That there is a place that they can go. Thank you so much for coming on the show and sharing all this information with us.
Thank you so much for having me.
Absolutely. All right, we don't have to forego these things alone. There are organizations, there are things behind us that we can push forward to make sure that the initiatives become the laws and the things that we need in our own communities. So take the opportunity to go to the website and learn more. We'll be right back with more Purpose Atlanta.